I am not a medical professional. I'm not a lawyer. Anything that's posted on my channel, I hope doesn't offend anybody. I'm just learning to live with fibromyalgia.
Okay, so just due to personal complications, I think that today would be a very good day to do a video on pain. I'm just going to talk about nature of pain, what pain is, signs and symptoms, and then I did a few charts on factor of pain, perception of pain, and then talk with you about pain assessment sheet that they give you in the hospital. And sort of what it really means, because their definition is very broad. So hopefully I can sort of clear that up a little bit for you. Okay, so what they say nature of pain is subjective and highly individualized. Its stimulus is physical and or mental in nature. Its influence with personal relationships and the meaning of life. It really can influence that. Only the patient knows whether pain is present and how the experience feels. That is very true. Everyone feels and expresses pain differently. May not directly proportional to the amount of tissue injury. That's really true. Some people can stub their toe and can't walk. Other people stub their toe and are hopping along the next day. Okay, so what is pain? So the definition, when you look it up, pain is chronic and regular. There's two different types. So let's see, definition of pain. An unexpected sensory and emotional experience associated with actual or potential tissue damage or described in terms of such damage. Okay, I see what they get. Definition of chronic pain. Chronic pain is the pain that lasts longer than 6 months and is consistent with reoccurring, a mild to severe intensity. It does not always have an identifiable cause and leads to great personal suffering. Example, arthritic pain, headaches, peripheral neuropathy. Any pain that persists beyond the expected time after a physical or emotional event or injury. Subjective complaints are magnified. Pain is out of proportion to clinical signs, they already said that, is accompanied by severe physiosociological issues, and responds poorly to conventional treatment. So that's what they call chronic pain. Some of that I agree with, some of it I don't, but that's what they're classifying or categorizing as pain and as chronic pain. So signs and symptoms of pain. Increased respiratory rate, increased heart rate, what is it? Peripheral vasoconstriction. Okay, so that's obviously deals with your peripheral vision. Elevated blood pressure, increased glucose level, diaphoresis, and dilated pupils, which I'm sure, I don't know if you can see, but I'm in pain today, so I don't know if that's actually dilated or not, but that's what they're saying on the internet. Now, I know also too, some people exhibit more like squinty eyes, intolerance to light. Those are all symptoms as well. So now let's see, factors of pain, influences, and relation. So this is how it was drawn out. So you got pain in the middle. And then you have physical factor, whether that's like getting bumped or nudged or stubbing your toe. You have the social factor, which has to deal with social gatherings, having to or feeling like you have to be there for some reason. Socially, it could even be, not laying in bed when you should and sitting out with your husband watching a TV show when you should be laying down. That would fall under social factors. Psychological factors could be having the pain creates depression. So psychological factor would be, yes, depression, things like that. So the way that this works is you have the pain. The pain can cause or affect the physical, sociological, and the psychological part of your life. So if you're in pain, you may not go out to the social events or want to hang out with friends or even talk on the phone, sit with your husband, do things with your significant other. Physical factor. If you're in pain, you cannot do the things that you would normally do when you're not in pain. When you're in pain, the psychological factor comes in. When people are in pain, they become depressed. There is a connection. There's also a way that if you reduce some of your social factors, your physical factors, and your psychological factors, that you can improve the pain. So if you do a little less during the day, you won't have as much pain. If you, instead of being a hermit crab, maybe going out or calling a friend socially, you're interacting, that creates happiness. Happiness reduces pain. Not take it away, I'm saying reduction of pain. Psychological factors would be, if you're happy, reduce the pain. So now with that in mind, your social factors can affect your physical or psychological factors, and your psychological factors can affect your physical and social factors, and your psychological can affect physical and social factors, which then go back to the pain. So I hope that sort of helps, as in influences in relation to pain. So perception of pain. There's an emotional, physical, and a psychological perception of pain. So the way you perceive it. So emotional is more of a chemical reaction, depression, sadness, anger. Those chemicals then cause your muscles to tighten. Then that sends signals to your brain that you're sore. A physical would be a contact or an actual physical event that directly correlates with the pain that is being felt, i.e. stub your toe, paper cut, bump your elbow, that sort of thing. That would be a physical pain. Now, psychological pain is an over-exaggeration of pain or the affected area, i.e. fibronerve pain. Another example is phantom pain. So usually that derives from, like if I don't take my medication, somebody just like, hey, excuse me, and taps me on my shoulder. Well, my whole side is feeling pain. That would be a psychological. because they didn't injure that area, as with the physical, and it shouldn't be tensing up due to a chemical, so that would fall under the psychological. Phantom pain is where it's actually amputated and you feel the nerve endings there, even though they're not. Also can feel the foot sore and it's not. So that is like psychological, that's in your brain. So let's say this is the pain assessment tool. So this is what you'll see when you go in for an assessment. They do 0 to 10 and then they say no pain, mild pain, moderate, severe, very severe, and worst pain possible. Now that, yes, I can agree with, but that also, no, I don't agree with. So I did up my own. So instead of very severe, it's just severe. And then instead of severe, it's bad. So for me, no pain is what I would be like, hallelujah, there's no pain. Mild pain would be my bring it on. You know, I got this. Minor aches and pains, but I'll be sore later. Now, for that one, I would say the pain is sort of random. It's not all over the body. With moderate pain, I'm okay. That's usually what I say to my husband. I'm fine, I'm okay. You know, basically sore but functional. So I might move slower, feel a little bit weaker. I'm sore and achy, but not all over. Now, I would say bad is when you're like, for the love of fussy animals, I can't do a lot that day. I would have a hard time focusing, sore all over, and I have like an annoying headache going on. So they would say that that would be what they would be calling severe. So that would be like in between, anywhere between moderate to very, right in that range. So that would be what I'd consider would be feeling bad. Like, so for this one, it would be a 7 to a 9. Would be holy shizballs, I'm sore. That's very painful all over. The headache's really bad. I have 0 strength to get up and do stuff and no mental activities because I can't focus on that at all. And then worst pain ever, what I call mother death, make it stop. Basically, if somebody was to say, oh, I'm a 10, I would perceive that as, or how I say is if I'm a 10, is if it was to stay this way for a long period of time, that depression would be really bad. Not even a long period of time. It could even be like 2-3 days. But I can't handle this pain for more than a day. Depression would kick in really bad. At that point, you would be almost willing to do or take anything to make this stop. If they said, do this or take this, you would seriously think about it. So for this, I would say the pain is all over. You got migraines, you're vomity, you're dizzy. That would be the worst pain ever. Sorry about the snoring. I have sleepy puppy here. So I hope that this helps explain a little bit. I'll go into more what my pain is, and you'll see other videos like that, and maybe go in depth. But feel free to let me know in the comments below if you agree with what I'm saying. If not, how you would maybe interpret one of these as everyone's, you know, 4 to 6 is different than somebody else's 7 to 9. And I think that when they do the assessments, that makes a big deal because you're perceiving their ratings differently than how they may be perceiving it. So yeah, that's it for today, and I hope I see you guys back soon. Alrighty, like, share, and comment below.